Welcome to week 3. My name is Dr. F. Yusuf. This week we will take a closer look at research methods. Lecture 5 will cover qualitative research and Lecture 6 will cover quantitative research and mixed methods. By way of outline for this lecture, we will be looking at the introduction to qualitative research. We would look at data collection methods and data analysis methods. We would also look at factors that will ensure rigor and trustworthiness of qualitative studies. Let's begin with the case study. A group of researchers from University X worked in a village in Town Z. They did a survey among the villagers and asked them what were their most serious problems. The villagers said that one of the most serious problems was malaria. The researchers tested the blood of some of the villagers and found that malaria was very common. They gave people in the village bed nets soaked in insecticide and told them that using the nets would decrease malaria. The people started using the nets. The research team tested the blood of the people again and found that there was a big reduction in malaria for those people who used the nets. So they felt the program was successful. Later, some other researchers came to the village. They found the people no longer used the nets. They said that the bed nets didn't work. The villagers were skeptical of outsiders and were less interested in cooperating in programs to reduce malaria. What are possible reasons why the people stopped using the nets? Please pause your video for a few seconds and think of possible reasons why they stopped using the nets. The real reason. In this case, the reason the villagers stopped using the nets was a misunderstanding. By malaria, the researchers meant infection with the malaria parasite, but the villagers meant all fevers. Therefore, although the number of malaria infections decreased, the total number of all fevers did not change much in the community's eyes. For this reason, they felt the nets did not work against what the community called malaria and abandoned using the nets. Ask yourself, how could the researchers have discovered the real reason? So with this background, let's now focus on what is qualitative research. Qualitative research is the study of the nature of phenomena, including their quality, different manifestations, the context in which they appear, or the perspectives from which they can be perceived, but excluding their range, frequency, and place in an objectively determined chain of cause and effect. Qualitative research generally includes data in form of words rather than numbers. When conducting a qualitative study, we need to be flexible. There are many methods we can use to achieve the same learning objective. We can ask different kinds of questions to learn the same information. If we find that a method or question we're using isn't being understood or isn't working well, we can change methods or use a different question. This is unlike a household survey where methods and questions are fixed before we start collecting data. We will be looking further at quantitative studies. Here are 3 commonly used data collection methods in qualitative research. There's observation, in-depth interviews, and focus group discussions. We will discuss each of these methods in further details. First, observation. Observations are particularly useful to gain insights into a certain setting and actual behavior. In participant observations, the observer is part of the observed setting. For example, a nurse working in an intensive care unit. In non-participant observations, the observer is on the outside looking in. That is, you're present but not part of the situation and trying not to influence the setting by their presence. Observations may be planned or ad hoc. Note-taking can occur during or after, depending on the feasibility. Next, we look at interviews. This can be unstructured, in which case the interview setting has no formal guide. It can be structured, where there is a rigid question list. And it can also be semi-structured, which is characterized by open-ended questions and the use of an interview guide. Some further details on semi-structured interviews. You may be wondering, how do you develop your interview guide? The predefined topics in the interview guide can be derived from the literature, from previous research, or a preliminary method of data collection. Example from document observations. The topic list is usually adapted and improved at the start of the data collection process as the interviewer learns more about the field. Across interviews, the focus on different questions may differ, and some questions may be skipped altogether. For example, the participant may not want to answer particular questions, or may feel the questionnaire is long and doesn't want to continue. Interviews can be audio or videotaped, but sometimes it is only feasible or acceptable for the interviewer to take written notes. We would want to compare structured and unstructured interviews from the interviewer perspective. So when we talk about structured interviews, it's standardized across multiple interviewers. It can rely on the script. Data has less researcher influence and may be self-administered, may constrain depth of understanding, and some relevant or important topics may not be covered because you're following the script, which is already predetermined. In semi-structured interviews, it is less standardized, as the name implies. It's ideal for fewer interviewers. Personal style or influence of the researcher is a key factor. It allows for the development of rapport and exploration of certain themes or topics. Quality of data depends on the interviewer's skills and judgment. It cannot be self-administered. From the data collection perspective, structured interviews are predetermined, they are systematic, and they follow a set range of responses, preset range of responses. They are usually quantitative. It's good for getting specifics, but it's really not ideal for deep discussion or understanding. Whereas with semi-structured interviews, the outline is not predetermined. Mostly they will be open-ended questions that allows for free response. So there's less control over the nature of the responses. It's usually qualitative, which is what we are focusing on for this lecture, and allows change based on the responses Flexibility we talked about. It's good for in-depth knowledge. It's difficult to compare data between respondents. Now we focus on focus group discussion. Focus groups are group interviews to explore participants' expertise and experiences, including explorations of how and why people behave in certain ways. Focus groups usually consist of 6 to 8 people led by an experienced moderator following a topic guide or script. The discussions can be audio or videotaped and transcribed later. There are advantages of conducting focus group discussions, and these include they are comparatively easier to conduct, they are relatively cheap, comments during the discussion could stimulate others to think about the topic, it allows to explore topics and also generates hypotheses. The disadvantages, on the other hand, include it may take some effort to assemble groups together. It demands interviewer or moderator to be really very skilled. Participants can have lengthy responses, or a few people can really dominate the discussion. It's not useful for gathering in-depth data on personal or sensitive topics. The discussion should be conducted in an atmosphere that facilitates dialogue. Let's focus our attention on factors that could ensure rigor and trustworthiness in qualitative research. Our aim would be to reduce bias and to increase trustworthiness of the study. Bias means having only part of the truth, but we use the information as if it were the whole truth. One way to reduce bias is by getting more information. We can get more information by looking at something in different ways. Triangulation helps to reduce bias. By triangulation, we mean using different ways to study the same thing. So using team members with different experiences and perspectives, or continuously cross-checking the information using different methods and type of informants. Let's just talk a bit more about the levels of triangulation. So you can look at different groups. So where is the information coming from? Different groups in the sense that people's age, you may focus on older people or younger people. You don't want to group them together, for example, in a focus group discussion. You may want to discuss with men separate from women. You may want to look at different socio-economic status. You may want to look at different ethnic groups. In terms of the investigators as well, you would want a multidisciplinary team. You may consider gender. You may want to have an insider or an outsider view. In terms of the data itself, the data could come from different locations. It may be at different times, for example, in different seasons. You want to consider all those perspectives to give you a broad view and to minimize bias in your study. We talked also about the different methods that can be used. So you might want to make changes within one method, or you might want to do things that are between methods across 2 different methods. With regards to trustworthiness, generally we say a trustworthy person is someone who tells the truth and does so consistently. What then is a trustworthy research? Or how can we judge what findings are worth believing? There are several questions that we could ask that would help us to assess the trustworthiness of the study. 1, have we really measured what we set out to measure? That would be the credibility of the study. 2, how applicable are our results to other subjects and other contexts? Transferability. 3, would our findings be repeated if our research were replicated in the same context with the same subject? That is dependability. And 4, to what extent are our findings affected by personal interest and biases? Conformability. Let's take a deeper look at each of these. With the credibility of the study, we're referring to the ability of the study to capture what the research really aimed at studying, meaning that the results are not simply the product of research design errors, misunderstanding, like we saw with the case study that we looked at, or influenced by unknown factors. There are several ways we can improve the credibility of a study. Prolong engagement by staying in the field until saturation occurs. By saturation, we mean, for example, if you're doing interviews, you realize that you start getting the same responses over and over again. You can have persistent observations, which are consistently pursuing interpretations in different ways in the field. You can also have triangulation, which we've talked about, collecting the information about different events and looking at the relationship from different viewpoints. You can also have referential adequacy, which really focuses on what materials are available to document the findings. We've mentioned videotape, which really is a good way of providing a record. So you do need a way of documenting what the findings of the study. Peer debriefing, which is done when you have a colleague of a similar status who would be able to come in. He's usually somebody, an outsider, who comes in to review the nature of the study and can also look at the insights and analysis of the study. The negative case analysis involves conscious search for data that don't fit the current working hypothesis. And when we talk about member checks, it's actually an activity that entails bringing back the results to the members of the studied group. Transferability of the study. It really refers to the extent to which the findings of a study can be applied or transferred to other contexts or settings. It involves considering whether the results can be generalized to other populations, settings, or situations beyond the specific one studied. Researchers strive to enhance transferability by providing detailed descriptions of the research methods, context, and participants, allowing readers to assess the relevance of the findings to their own situations. This transparency helps others to determine if the findings are applicable to their context. It is important to remember that qualitative research often prioritizes broad and richness of understanding over a broad area. So transferability is more about providing insights and understanding rather than generalizations. Consistency and dependability. We refer to the reliability and the stability of the research findings when we talk about the consistency of the study. It involves ensuring that the study's methods, data collection processes, and analysis procedures are consistent and dependable so that if the study were conducted again or reviewed by others, similar results would be obtained. The researchers establish consistency by clearly documenting their research process, including detailed descriptions of data collection methods, analysis techniques, and any changes made during the study. Ensuring consistency helps to build trust in the study's findings and conclusions, and demonstrating that the results are reliable and can be trusted by others in the field. Neutrality refers to the researcher's ability to maintain objectivity and prevent their own biases from influencing the research process and findings. It involves conducting the study in a way that minimizes the impact of the researcher's personal beliefs, values, or perspectives on the data collection and analysis. Conformability is about the degree to which the findings of the study are based on verifiable data and can be confirmed by others. Researchers strive to achieve neutrality by being aware of their own biases, preconceptions, and assumptions, and by employing strategies such as using multiple researchers to review and interpret the data. This helps ensure that the findings are grounded in the data rather than shaped by the researcher's subjective viewpoints. So we now look at qualitative data analysis methods. The qualitative data analysis process itself involves defining the questions, gathering the data, organizing, coding, and making hypotheses. Qualitative data methods include content analysis, which involves systematically analyzing text to identify patterns and themes. Narrative analysis, which interprets stories to understand participants' feelings and behaviors. Thematic analysis, which identifies patterns and themes in data. Grounded theory analysis, which generates hypotheses from data. Choosing a method depends on the research questions, data type, context, expertise, and resources. We would summarize our findings on qualitative research and also compare it to quantitative research, which is what we will be looking at in the next lecture. So for qualitative research, it really answers how and why. It gives you a participant's perspectives. It explores hypotheses. And like we said, it really describes, so it uses a lot of words. It provides more in-depth information on a few cases and is less structured. It's less generalizable. There are no statistical tests. The results are presented in themes, in categories, and in narratives. Common methods include focus group discussions, which we've talked about, individual interviews, and participant observations. Whereas with quantitative research, it answers who, what, how much, and where. Researchers' perspectives is what it gives more. It confirms hypotheses and it quantifies, so we're able to get numbers. It gives less in-depth but more breadth of information across a large number of cases. It is more structured. It is more generalizable. We have statistical tests that are used for the analysis. Results are presented in charts, in graphs, and in numerical summaries. Common methods will include surveys, interviews, longitudinal studies, and controlled observations. Here are both qualitative and quantitative methods are important, and whether we use one or the other depends on the research question. Here are some references that you could use to get more insight and some examples of qualitative studies for you to review. Thank you.